And as people start to return to the workplace, it seems lots of men are now feeling pressure to look their best. Huge rise in number of men booking anti-aging procedures, apparently, especially Botox. And one of those men is 41-year-old HGV driver Billy Murphy. Billy says he now feels more confident thanks to Botox.
Well, there's certainly be a difference. Billy, we're looking at your picture there, my friend. Are you happy with? Matter of fact, you look even better in real life than you do in the first off picture that we've got. Let's see Billy in real life here. Yeah, I think it's all seems to have settled down. Does it take a while to settle down?
It does, a good couple of weeks. Obviously, the period only lasts from 4 to 6 months, so you know you do have to keep topping it up. But yeah, it does work. And
when did you have it, Billy?
So I've been having it for a couple of years now.
Okay, and why did you decide? Did somebody else tell you about it?
Yeah, on my forehead, I was really insecure about how it looked, and just it's something that I wanted to do. So I've done a bit of research into it. And then obviously went aboard and booked it up.
Have you got a partner, Billy?
I do, yes.
And what did they think about it?
No, she says the results are good.
Yeah. Okay. Now, what about colleagues? And I mean, I don't know if you work alone or you work with people, but you're an HGV driver. So does that mean you drive trucks?
Yeah, I do, yes. So I do drive alone, but obviously in the yard there's guys there of different ages. So... But to be honest, they don't really say much about it.
Did you tell them you were going to do it, or did they notice when you'd had it done?
I told them after I had it done.
And the reaction was what?
There was a bit of banter going around, but I'm got big enough shoulders to see past that.
Yeah, I think the difference is in our business, in our industry, it's more abnormal not to have it done, where you are probably an unusual sight in your business.
That's correct, yeah. I did used to be a sales executive for many years, so that's one of the reasons probably why I felt that I probably wanted to have it done.
Well, let's now go, Billy, we'll come back to you again very shortly. We're bringing in now plastic surgeon Dr Aoife Turner. And Dr Turner, as I understand it, you've seen your male client list grow. What is the size of growth we're talking about here?
So I would say, I mean, it's a trend that I've been noticing over the past number of years, but especially I think since the beginning of the pandemic, and especially in the last 6 months, I'm seeing much more men coming through the door. And I would say probably it's grown in the last 18 months by about a third. So, I mean, you're looking at, I think, maybe 5 years ago, it would have been 1 out of every 10 patients would have been a male patient, and now maybe 3 or 4 out of every 10. So it's a pretty sizable growth within a very short time frame, and it's a really interesting trend to observe.
And what type of men, Dr. Turner, and what kind of age groups are we talking about?
So it varies completely depending on what type of treatment we're talking about. So I mean, if we just focus in on Billy's treatment, say for example Botox, it's men late 30s, they start to think about it, and then onwards, up until their 40s, 50s, and 60s. Other treatments, for example, I'm getting a lot of males coming through the door, for example, here at Cosmetics. They'll come to see me for, their eyelids, their upper and their lower eyelids. They're starting to feel, they're spending a huge amount of time on Zoom. They're just coming in and they're saying, you know what, I'm tired. I'm looking a little bit saggy here and here, and I don't feel like myself. What can we do? And those men will tend to be kind of from late 40s onwards, even into retiree age. I have some patients in their late 60s and even early 70s.
So Doctor, could I just interrupt you there? If you're whetting the appetite of anybody watching there and they say, maybe I could do with my eyes tightened up, I'm just asking for a friend I know, how much would that cost?
Well, one of the great things about all these surgical procedures nowadays is that we perform them in local anaesthetic, so the cost has also reduced lately. So I think that's also been a huge contributing factor for more and more men, to actually, pull the trigger, so to speak. So, for example, an upper eyelid lift will be around the 2,800 mark, procedure takes, you know, about an hour, local anaesthetic, in and out, essentially. And if you're combining that then with the lower lids, you know, it would be probably about double that, so about the 6,000
No,
mark.
you see, I could see me getting my turkey neck done or something, but I would be frightened about my eyes because, truthfully, doctor, you can always tell it's been done. And you see so many people, ex-football players, whatever, on telly, and they all just look...
Isn't that the point, that you're supposed to see it's done?
No, they look ridiculous.
I would tend to disagree with you there. I think the key is, and I think one of the reasons that more and more people, and especially men, are coming in now is because we're being less invasive. You know, I will always ask patients to bring in a photo from maybe 10 years ago. So we want to go back just that, you know, frame of time. Not trying to make people look maybe 15, 16. So it's very gentle, the surgery nowadays. And the key is so that you feel, you know, the patient feels fantastic. They feel they see a difference, but that other people, you know, this windscreen eye, that would be, to me, that would be a horrible result, a poor result. Would not be happy if one of my patients ended up like that.
How much pressure do you think comes from social media now? Because, you know, with so many, the perfection across social media, is that affecting men as much as it often affects women now?
I don't think it's affecting men as much as it is affecting young women in particular. I feel for men, what men are getting more from social media is perhaps information. You know, they'll see somebody, I think especially when it comes to procedures like male chest reduction surgery or liposculpting, they will see people who have had it done, follow their journeys and gain information that way. And that might be the reason why they decide, you know, okay, well, it wasn't, you know, I've seen what's involved. I want to do that. I want to, you know, do that for myself. I feel like it's giving them information, but it's not, the male patients don't necessarily feel under pressure to look a certain way. I hear it day in, day out. They, you know, that when they come to see me, and the first thing they will always say is, you know, I don't want to look like Brad Pitt, or I don't want to look like I'm not 18. I don't want to go on Love Island. It's just these certain little things that are bothering me. I don't feel like myself at the moment with them, and I just want a little bit of help.
Billy, the doctor's saying there is just the little things and little tweaks and whatever it is, but where do the little tweaks end? What's next for you, or is that it?
No, I think when it's time to have my eyes done, definitely I will be having my eyes looked at. So.
And do you think what we're doing and what we're talking about now, we talk to you because it seems to be, you know, a bit out of the ordinary to hear about a heavy goods driver doing this, getting this done. Do you think this will become the norm in the next few years?
Yeah, I definitely do. I think as times change, obviously, like everyone's saying, the things will progress. More people are going to start coming out and saying that they want to have the Botox and even talking to their friends about it as well. So, yeah, definitely going to become more common.
And how's it made you feel about yourself, Billy?
I definitely feel much more confident about myself. Certainly with things like social media and stuff like that, it does help.
Yeah. Okay. Doctor, just to finish with, we'll get it. Barry, give me a wee close-up of my face here in one. Right.
She's
Doctor,
not a miracle worker. Come on.
Doctor, what would you do if you look at me there? How much money do you think I'd have to spend?
Absolutely nothing. You're beautiful as you are, Eamonn.
See. Thank you, Doctor. Much appreciated. Thank you very much.
Should have gone to Specsavers, Dr Turner.
Dr Aoife Turner there and Billy Murphy.
You're lovely just as you are, darling.
You are.